Hello, today is February 24th, 2021. It is Wednesday. My name is Jessica Taylor. Um, and this for the Voces Oral History Center at the University of Texas at Austin. Please know, ma'am, that this recorded interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin, and it may be made available online via YouTube or a similar platform. If there is anything you do not wish to answer or talk about, especially given that your recording may appear online, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to before we go on. Voces' wish to archive your interview along with any other photographs and documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other material you donate to Voces. Number 1, do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes.
Okay. Do you grant Voces copyright over the interview and any material you provide?
Yes.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes.
Okay. We have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to the Benson, we would strip out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
Yes.
On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or email with journalists?
No.
Okay. There's also a tech one, but I'll send that to you over the internet.
Okay.
It's
Is this study IRB approved?
Yes.
Oh, it is. Okay.
Or it's exempt because it's oral history.
Okay.
Yeah, any other questions for me that I can help with?
So just to make sure you'll be able to blur my face, right?
Yeah, and I'm gonna email them to just triple duper, quadruple, make sure, but they do have like blurred videos on the site. So
Okay, thank you.
yeah, absolutely. All right. So thank you again for talking with us today. Can you tell me how you first learned about COVID-19?
I learned about COVID-19 through the news and through my classes because I'm studying public health. Yeah.
What were your initial reactions to the information about COVID-19?
At first I didn't think it was gonna be as bad as it has become now. And I thought that it was gonna be over by the summer, hopefully.
At what point did you realize that it was serious?
I would say so. I think the pandemic are kind of everyone started taking it seriously around March, like maybe second or third week of March. And I had gone to Canada to visit my boyfriend. And when I was there, the US and Canada closed the border. And I never thought that that was something that was going to happen. So I think in that moment, I realized that it was actually really bad.
How did you feel in that moment?
I was very stressed because I have a student visa, so when they closed the border, I wasn't sure if I was gonna be allowed to come back, and because everything was kind of up in the air, I actually had to change my flight dates to because I was supposed to go back a week earlier, but then I think they canceled the flights to Europe, um, and then a lot of people were traveling, so I was like a little scared that I was gonna get COVID in the plane, but then everything turned out fine. I was able to come back, but it was really stressful. Yeah.
How did your family react?
To me being in Canada or to the pandemic?
Yeah, to the initial months of the pandemic.
Oh, my parents were actually much more stressed than me. Um I think they took it they were I don't know, they were more scared. My mom when try to go shopping for like disinfectant, I was like, "No, don't worry about it. It's gonna be okay." But then yeah, they were a little bit more scared than me. Yeah, they've been taking it quite seriously, my parents.
Why do you think that is?
That they've taken the pandemic seriously?
Yeah.
Um, well, because I don't know, they're pretty educated on like everything that's happening and they're constantly watching the news. Um, and I mean, they're watching like Dr. Fauci or what the CDC says. They're very like on top of all of that. And my mom is a teacher too. She's trying to be really safe. Um, she has a lot of allergies and sometimes medical issues that don't like where she can't get medications. So she's trying to be really careful not to catch COVID.
Over the course of the last year, how has COVID impacted you?
Oh my gosh. Well, I th- I think personally, let me think. So in March, I had a job that I was supposed to get over the summer. Because I work at the Language and Culture Institute at Virginia Tech. And we were supposed to get students to come to tech, but then because of COVID, that got canceled. So I lost my summer job. Then I haven't been able to see my boyfriend like a long time because he can't come to the US because of everything that's happening. He came once, he came over Christmas, but other than that, it's been really difficult for us to see each other. And then I think because I'm a public health student, um, it has impacted my kind of my work life balance because there is so much to do for us as public health students that it feels like every day there's just some new thing, and I feel like I've been working every single day 14 hours a day nonstop since March. Maybe not since March but May. So I don't think it has impacted me as bad as other people because I haven't really lost my job or no one in my family has gotten sick, or I haven't lost a significant amount of income or anything like that. That it has impacted me obviously a little bit.
Can you talk about your organizing work around COVID in the area?
Can't Oh, if I can talk about it. Yeah, so it all started because I was a graduate fellow with my program over the summer, and we worked with the town of Blacksburg, the health department, and um, Virginia Tech to start the Be Committed, Be Well campaign. So I was part of that initial campaign. And then I did some resources for Spanish speakers. I did contact tracing, like volunteering contact tracing for the Roanoke Allegheny Health Department and the New River District Health Department for Spanish speakers because there's not that many Spanish speakers in our area. So they really needed help with that. So I did some of the resources that they sent to the people that test positive. I've called many people that had COVID from the Hispanic community. And then now we have the town of Blasworth is funding this program called COVID Crushers, which is a peer-to-peer education program. So last semester we were downtown every Friday distributing masks, resources to any community member that would come downtown. But then this semester we're helping with testing at the health department and with the vaccine clinics that have started. So I kind of coordinate that.
That's amazing. Why did you decide to get so involved in all of these different aspects of public health in the area?
Um, because there was a really big need for people to help out. Especially like I said, with the Hispanic community in our area, there has been like a lot of the times the health department, I don't think they have anyone that speaks Spanish that is hired, or maybe two people. But over the summer there were a lot of cases in Roanoke um, that were mostly like they were mostly for Hispanics. So it was just a constant need of someone that could call them and just speak to them in their language because all of them didn't know how to speak English. A lot of people were scared because of their immigration status. So I was just helping out with that. I think that was the starting point when I started seeing that need. And then now it's just with the vaccines and like the variants and all of that, the cases increasing. It's just they just need more people to help. So I've just made it because of that, because of the need, really.
And so calling people and making sure that Spanish language resources are out there, what is that like for you to contact trace in terms of what's going on for you emotionally or mentally?
Um, well, some sometimes it is satisfying because people are just grateful that you can talk to them in Spanish, which is hard to get, or like a person that like can communicate full on in Spanish. So there's that, but then there has been a lot of very sad stories that I have heard, and people that really are trapped in the system and the system doesn't help them. So I've been able to see that firsthand, and I just it's very painful because sometimes there's nothing you can do to help these people. They're just in terrible situations that they can't get out of because of the pandemic. Like people that are losing their houses, people that their I don't know, their husband, their wife died, their kids are sick. They're gonna get fired because they're not going to work. They work minimum jobs. They're gonna lose their house, their mortgage, their cars, and over the summer and even until now, like I've heard the stories countless of times, and it's really heartbreaking to hear that. And sometimes you can help, but sometimes it's just the system should be able to help them, but it just doesn't. It's not equipped, or I don't know. Yeah.
Were there moments where you, what were moments where you realized that what you're doing is worthwhile in providing like Spanish language resources and also just Spanish language connection?
um well, there has been like a couple of them. For example, one time I had there was a construction site that had a big outbreak, and none a lot of the construction workers didn't know how to speak English. So I went, and it was like I was just able to talk to them and make them feel reassured that the that the health department was going to help them not lose their job and provide them with some resources. Most recently, just this week, actually, one of my friends, who's also a contact tracer, she's a Spanish contact tracer, she or case investigator, she was helping a woman that was in a very, very tough situation. And we were able to set her up with resources with a case manager. She posted in a Facebook group to get help, and a lot of people donated to her cause. And I think just the fact that one person can make a bit of a difference in someone's life, even if it's small. Like even if I call someone in Spanish, it's like it might not seem like a lot, but then certain people, they can't go to the doctor because they can't afford it. So just being able to talk about what they have, and someone listening to them and reassuring them and saying like, I'm here and I understand you and I'm going to try my best to help you, like it just makes it worthwhile, even if it's just like a 5-minute conversation. You can make an impact, I think.
Absolutely. And for your family, you mentioned your family hasn't been sick, but how has your family been affected by COVID?
um I I don't think my family has been very affected by COVID. I we have not really been financially affected by it, or no one has gotten really sick or anything like that. In my extended family, my grandparents, they live in Bolivia, and they have been very isolated. So I think it has definitely taken a toll on their mental health because they're older adults and they can't really go out. So I think they have been more affected than my immediate family.
What is communication like with your family in Bolivia, like during this time, especially compared to earlier times?
Um, I think it has been pretty nice because before, I moved out of Bolivia when I was 9, so there were many like birthdays or events that I missed, like graduations or anything like that. But since everything is on Zoom now, for the first time in a really long time, I was able to be part of that. Um, so yeah, I think communication has increased a little bit. Yeah.
That's amazing. Like an unexpected positive.
Yeah.
So you are currently in a program now to finish your education. How has class and finishing up been affected by COVID?
Okay. Um, I think at first in like last year, March to May, it was difficult because we were just adapting to it. And definitely I'm missing all my classmates and going to class and getting out of my room. But I think for public health students, it has really been an interesting experience because um, we have been able to use everything we've learned in class in the real world. So all of my classmates are working with something related to the pandemic, which is something we obviously wouldn't have had the chance to do before. So in some ways, it was like brutal to have the pandemic and do classes online, but on the other hand, it gave us a chance to learn more.
In terms of what you're learning, especially when it comes to public perceptions of health. And now that you're doing the work on the ground, also, what kind of patterns are you noticing when it comes to concerns about COVID in the Spanish speaking community? Um, what are people most asking questions about or talking to you most about?
Um, well, let me think. I think people didn't know where to get tested. And they didn't know that they didn't need ID or an immigration status or like even insurance to get tested in the New River Valley. So they asked a lot of questions about that. People ask a lot of questions of what treatments there were for COVID, and they're none. So a lot of people would always ask me, "Oh, do you think like drinking tea with lemon is gonna help, or you doing this?" And I just couldn't really give them an answer for that. And then now, some of the misconceptions there have been in the Hispanic community is that about the vaccine. Um, so some people believe that it causes infertility and um, that there is a chip in the vaccine, and it has been pretty widespread and I think more prominent in the Hispanic community. So we've been trying to do some messaging in Spanish to help with that, help with those debunk those myths. And then another thing that a lot of people ask is if they get COVID, if they should get retested, for example, and if they get positive, like how long do they have to be off work? But the new guidelines say that you can get a positive test for a long time, even if you're not infectious anymore. So a lot of employers, not only Hispanics, but all over have been kind of spreading a little bit of misinformation in regard to that. We've been working towards that.
You mentioned that the misinformation is being spread. Do you have a sense of how that's happening, like in terms of social media or family, or like how it's moving?
Mm. Yeah, probably social media. And I read an article by the Washington Post, I think, or New York Times, I don't remember, that in the Hispanic community, it was possible that it was being done because of WhatsApp groups, where they forward information. And because WhatsApp is encrypted, it's really difficult to take it down. But in our community, I'm not 100% sure. Maybe word of mouth, or I'm not 100% sure.
Another thing that has come up in the past is masks. Are you noticing trends in how people are talking about masks in your work?
Um, I think in Blacksburg when we were distributing masks, most of the people were wearing masks. And a lot of people were very receptive to getting the free masks we were distributing. So from what I've seen, and I haven't really seen it as a problem, but my opinion might be a little biased because I was doing this near Virginia Tech, where there's a lot of students, where they have to wear masks and all that. So yeah, it might be a little biased.
That's all right. I want to switch gears and ask you about current social movements. So lots of things have happened in the last year that don't have to do with COVID, but well, COVID adjacent, including Black Lives Matter and um, other social movements that are also driving media, but also like driving movement of people. Um, do you have a sense of how those movements have impacted your day-to-day life?
Um, I think, let me think. um, Obviously those movements are very important, and I think for me what they have made me realize is, um let me think. I don't think they have impacted my personal life on a day-to-day basis. Um but like when we're talking about the Black Lives Matter movement, but there has been other things, for example, such as immigration reforms and that have or immigration like issues that have yes that have affected me. Um, and I think Black Lives Matters and those issues make me much more aware of it, and especially as a future public health um, professional, I think is really important to keep them in mind and to try to dismantle those um, sorry, I forgot the word, systems of oppression. Yeah.
So has it come up in conversations with family or with classmates, either in terms of Black Lives Matter or in terms of immigration reform in the past year?
Oh yeah, definitely. Definitely. My sister is a very active advocate of Black Lives Matter. And um I am too. I'm very pro this. I don't really or I have not participated in any protest or in any I'm not very vocal about it because I'm an immigrant, and I think sometimes immigrants are censored because we're scared of if we voice our opinion or is gonna turn against us when we're applying for visas, green cards, permanent status. Like you don't know if you can get arrested on a protest. You don't know who's watching your social media. So I am very pro it, but I am not like very what is it called? I don't speak about it too much. It has definitely come. We've talked about it a lot in class. Last year we were taking social determinants of health class where we talk about all of this, and I really learned a lot about how what's happening right now has been happening for years, and a lot of people don't know. For example, they don't know about redlining, or they don't know about how African Americans or Hispanics have been so disadvantaged, and this is just like a generational thing. So I've been definitely being try to educate myself this year after all these movements and all the immigration reforms and after COVID, because COVID has disproportionately impacted minorities. So yeah.
Is your conviction in dismantling systems of oppression, has that changed over the last year because of COVID? Either you or your families, like your thoughts about it at all?
Um, could you repeat the question? Sorry, I didn't get it.
Yeah, I'm not phrasing it super well. Uh, how have your ideas about dismantling systems of oppression changed over the last year? Maybe are you more aware or focused on different things?
I think for me, really, it has really made me open my eyes towards immigration health or immigration reform. Because as an immigrant, I admit that I'm a little privileged because my parents are here. I have legal status in the country. I'm a student. And even though I can't access a lot of the resources that the government has, for example, the stimulus check or anything like that, I am part of a privileged group of immigrants. And when I was doing contact tracing or working with these communities, those privileges are gone for them. And I think for me, it has really made me think about what I can do and how I can help to decrease that. And sometimes, like, there's nothing we can do because it's depending on policy, but sometimes there is little things that we can do. So yeah, it's definitely changed my work and the way I think about it.
In terms of your work, what have been kind of the reactions from the Hispanic community that you've been talking to about your work?
Um, like leaders of the community or like community members?
Both the people that you're talking to and leaders in the community.
I have not met a lot of leaders from the community that speak Spanish or that are, yeah. And I have not really worked with them. But from the people that I spoke to when I was doing contact tracing, which is the most I've been in contact with Hispanics, because when I was doing outreach downtown, it's mostly students. They were very grateful and very open to following public health guidelines. I think we hear a lot of things about people being mean to the phone to contact tracers, case investigators, or not following, not wanting to follow the rules. And from all the people I spoke to, I had never had a bad experience. Everyone was so nice to me. And really willing to cooperate, even if they were scared to share contact information. They would just do it because they knew that it was the greater good. And I had a lot of that from the Hispanic community. Oh, like obviously I can't go out. I need to protect my community. Um, yeah.
Since you started doing this work, how have you seen the needs of the Hispanic community you've been talking to change over time? Because a lot of things have changed in the last little while.
Um, yeah. Well, most of the contact tracing I was doing was definitely over the summer. Now I do some of it now, but not as much over the summer. I was doing it every day. But I think even if the needs have changed, it's still the same systematic issues, you know. I can't um I can't apply for this resources because I'm not an American citizen. I'm scared to give you my information because I don't know what you're gonna do with it, and what if someone finds me and I don't want that. Um, so I think the needs are just like things that we can, like us, we can't fix. It has just to come from up there and try to make more like nicer policies towards this. Um, yeah, I don't know if that answers the question.
No, that's great. When you think about individuals that you've talked to,
hmm
um, what are they thinking about as their needs, like their most urgent and pressing needs? Like, what are they talking about with you?
So it would depend, but most of them were worried about their job. Um, Not receiving income for 14 days can be devastating to some families. Some families can lose their home and their cars and everything if they don't work for 14 days or 10 days. Um, so that has been definitely another thing that I've heard is that certain companies are not very good at following public health guidelines. Um, so that's why a lot of outbreaks happened. And a lot of community members in our area actually live in congregate settings that we might not know of. So, for example, a lot of workers live together, and a lot of them don't have cars to go get tested. A lot of them don't know how to write or read. A lot of them, um, yeah, I think I had one more in mind, but I forgot. Let me think. Yeah, I think so. The needs are just, yeah, work, housing, not being able to, because a lot of people were doing essential works, minimum wage jobs. Um, so I think those are their needs that needed to be attended during the pandemic.
When you were talking about folks living in congregate housing,
Mhm.
do you have particular like industries in mind where that has been the case, or particular areas of the New River Valley?
Yeah, a lot of restaurants that you might not think of because, but a lot of the workers from the restaurants live in one house. Like you can have 10 people, 14 people working for the same restaurant, working in the same house, living in the same house. Construction. Oh, I remember what I was gonna say. A lot of the people that come to our area and are, for example, construction workers, they and farmers as well. They move constantly. They stay 3 months in our area and then they move to another state. For example, I don't know, Texas, North Carolina, everywhere around the country. So it's really hard for them to access any resources because they don't have a stable housing, and they all live together when they come, and they all carpool together to go from wherever they're working to their house. And then uh yeah, some of them live in trailers all together. They all eat together, so that, some of the outbreaks are because of that. Yeah.
When outbreaks happen in those settings, how do people respond to that?
In what sense?
So if everybody in a single trailer gets sick,
Hmm.
what is the strategy that they employ to make sure that they have food, um, or are able to keep living there?
So yeah, that has definitely been a problem because it can take like literally the whole, let's say if it's a construction site, it can take the whole construction site down and everyone has to stop working because they all live together. But a lot of the employees have been supportive of that. Like if they will just let them, try not to fire them from their jobs and just let them quarantine for 14 days. In regards to food, most of the people I would say have friends or church. Oh, church. Yeah, church also is a pretty big place where there's outbreaks. Churches that can drop off food for them and help them out during the week or while they're quarantining. So yeah, a lot of the people did have support, like to get food and others.
Can you say more about the role of churches in either providing support or becoming a center of outbreak? How do you see the role of the church in pandemic times for the people that you're talking to?
Um, yeah, so this was over the summer, so I'm not really sure if a lot of things have changed, but there were a couple of outbreaks because people were still going to service in the churches, and then yeah, but also I think churches have a pretty big community, so they were able to help people out and provide, let's say if there was an outbreak, a member would just be able to provide all the people that are part of the church. So so it was like pretty cooperative. Yeah.
Okay. So going forward, especially, you have more of a zoomed out perspective at this point. Um, how do you see the needs of the Hispanic community changing? over the next few months as we approach a year of this?
Well, in different ways. First, I think that um the needs need to be focused on getting the vaccine, and there needs to be a lot of outreach to do that, and to reach out those communities that, like I said, is sometimes harder to reach out to them because they might be scared of the system, and they might be scared of what's in the vaccine, and sometimes, um you know, I don't know, with the ICE detention thing where they um remove, like, they did hysterectomies. I put myself in this people's shoes, and I'm like, yeah, there has been horrible things that had happened to the Hispanic community. So the mistrust is there, and we have to really work towards trying to gain it back. Um, so first that, and then second of all, some people that we may think because the vaccine is here that the pandemic is over and people are suffering less, but that's not true. Like, there's people that are just starting, they just got COVID and they're just gonna lose their house. And it's like the same situation as it was in March. Like, this just continues, and there's little we can, I feel like sometimes there's little we can do. Like, there's just limited resources, and um especially in our area, for example, besides Casa Latina, which is in Roanoke, I'm not really sure if there's somewhere where these people can go and get help in their language. And like, even if they want to access a free clinic, they have to have a social security number, which a lot of them don't. So there's just these barriers that there's almost like so little we can do unless we invest so much money. Um, Yeah, like, I think what our Hispanic community members should do is help out because they need people that know how to translate. They need people to make resources. They need people to be at the vaccine clinics to make sure that someone needs to fill out the form and they know how to do it. And there's people that don't know how to read and they need to be read on in Spanish. And it's just so big, but I feel like no one really talks about it. Yeah.
Um, is there anything, any specific story from your experience that you would like to share about COVID that I haven't asked about?
Um, a specific story? I don't think so. I think I've shared everything. Um, yeah.
Okay. Um, anything from family or from your time organizing with COVID crushers or anything that has stuck out to you or that you think about a lot?
Like, more positive things.
No, 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 no. I'm just rephrasing the question.
um, anything that stuck out to me. I was definitely able to spend more time with my family, which was really good. Um, but yeah, I can't wait to get back to normal life. Um, I miss my boyfriend. That's my other thing, but I think that's all.
That was a question that I wrote down actually, what it was like to see your boyfriend at Christmas for the first time in a long time.
It was amazing. It was so great. He came, and then we were met family during Christmas, and it was his first time in Blacksburg. We had met in Canada because I went to undergrad in Canada. So we've known each other for a really long time, and then it was his first time meeting my parents. But we had a really good time. It was really cool. And then he left, and I miss him more. And now the border is even worse because Canada is asking all incoming travelers to stay in hotels, and you have to pay $2,000 for 3 days. So it's like so much harder now. Like I don't know when I'm gonna see him next. Yeah.
Well, thank you again so much for being so honest with us. Anna, do you have any other questions you wanted me to? All right, so I'll go ahead and